Hello, my name is Ana Correa, Program Director for Clinical Careers at the Office of Career and Professional Development. Welcome to Epilogue 2, where we're going to discuss how to assess your needs in the workplace as well as the interview and negotiation stages of your job search. Specifically, we're going to learn about acing your interview by discussing the two most important perspectives of the parties involved. That's you and the employer. The first things to consider are your needs. What do you need and want in terms of support, and what do you value? So we'll begin by exploring how to assess a workplace. Next, we'll prepare for what the employer is looking for, what they need and want to know. So we'll review interview question types and strategies for answering them. And lastly, we'll put everything together and discuss negotiation and how to ask for the support you need as new professionals. Each section will have a separate video clip with its own handouts, so be sure to have your handouts ready to fill out at the end of each section. So let's start with what you want to know: how to assess a workplace by identifying and prioritizing your most urgent needs. Before we begin, however, let's see what our alumni, Monifa, Aaron, and Stephen have to say about their transitions into the workforce and what the expectations and support were like and what you can do to help yourself, specifically what to ask for and how.
Being a student there, it didn't translate when I was hired. So because I was a student, I would say I actually received less training and structure when I first started there, because they, in their mind, they were like, hey, you've been here, you should know the system, and by the way, you have an intake, next week. And I was kind of like, what?
And I would really, encourage, one, making sure you ask questions, because if you don't ask questions, it seems like you're not interested or you're not prepared, or you really aren't sure kind of how best to interview.
What is the workload expectation? What's the opportunity for ramp up, if any? Are you expected to just hit the ground running, or is there support for letting you ramp up? What's the caseload? Is there a specific time for administration and charting? What kind of case management is expected? Is there a lot of case management, or just a little? Or what's the how do I ask for help if I feel I need it? What's the model for interacting with my attending physician? How broad is the scope?
Do you guys have clinic, social events that you do? What sort of team building events do you guys have in place? How often do you guys meet as a crew outside of work? Those are all kind of, I think, tactful telltale signs of the temperament of the clinic socially.
Those are some great support and assessment questions that we'll be exploring further in this section. In seeking support, the literature tells us that NPs with the best outcomes also develop an awareness of the transitional process. That means that they expect their first year to be uncomfortable and full of growth. This is normal. People who reflect on what they're learning and remind themselves that it's a process as opposed to spending time on fears or denying your limitations generally adjust more quickly and do better. It may sound counterintuitive, but to succeed, both alumni and the literature tell us that new APRNs should not set unrealistic expectations, and rather they should embrace and acknowledge their lack of command as an APRN. Even if you have some years of RN experience, this doesn't automatically confer expert status in another discipline. So, embracing your learning curve is essential when starting out.
Okay, so now that we've heard how transitions can throw you curveballs and different support questions new APRN should ask and how, we're ready to dive deeper into this topic from a more personalized perspective. And so the question we need to consider is, how do you know if a practice community can support you if you aren't clear on what you need? There are two dimensions to assessing a workplace. So let's start with step one. You can assess a workplace without being clear on what your criteria is for support, and that means assessing yourself first. It's also worth noting that all these successful alumni we spoke to had a plan to get to where they assessed they needed to be. They're like Yoda alumni. So step two is, once you assessed what you need and want, it's time to create a prioritized plan to negotiate for it. And we'll cover negotiation in the third portion of this session. Some of you may be wondering, wait, so you're telling me I need to assess myself first? But don't I need to know more about the employer and the environment to figure out if I'm a right fit? Not so fast. Let's consult our Yoda alumni first.
Know the place that you're interviewing at. So, know a little bit about them, know what draws you to them is important.
But really thinking about where you want to get and how you think you're going to get there, and sometimes writing that down. Because then when you start to actually write it out as if you're going to show it to somebody, it becomes clear that you don't either really know where you want to get or you really don't know how you're going to get there. But even just knowing that piece of it, I think allows you then to try to seek other support people or areas, or, may not be someone in your direct place, but it might be a classmate, or it might be another mentor that you've had in a different profession. But just knowing that you maybe don't even know sometimes is the first step.
The reason we assess ourselves first is because as new professionals, you know better than anyone else what you need. Just like an employer is clear on what they're looking for in the right candidate, you need to be clear on what you're looking for in terms of support. So unless you're crystal clear on what you don't know and what you need to fill in those gaps, you won't be able to assess whether or not the employer can support you or be able to articulate how you'd like to be supportive. Think of it as writing your own employer support job description, because you're interviewing employers too. So let's get started on the first step then, assessing yourself. We're going to figure out what you know and where you are still growing. To begin the process, we're going to be using two handouts. One is provided by OCPD with this video, and the other is provided by Sun specifically for CNS students. For everyone but CNS, please see the OCPD provided NP competencies rubric handout to assess your skill development in 7 core NP areas. This rubric was developed by nursing researchers and clinicians in both academia and clinical practice, but it was slightly modified for our students by our own professor, Kim Dow, to help new grads successfully transition into practice. For CNS students, because our CNS students have been evaluating their process in achieving CNS competencies throughout their program, CNS students can use their individualized reports, which are delivered throughout your training, for a cumulative reflection of your competencies in this area. Now, the goal of this exercise is to identify what your learning curve will be so you can develop a support plan for yourself. Follow the instructions in the handout, and we'll see you in the next video section.